Now, all of those numbers count for every person who has gotten positive test since the beginning of the pandemic, even if they've gotten better. Well, viewers have told us they want to know how many people have recovered from COVID-19. But Pima County's top health expert says the state is not tracking that, and she tells us why.
The math might seem simple, but it's not for COVID-19. Pima County Health Director Teresa Cullen says getting to the recovery results is not possible right now.
Wouldn't it be great if it was simple math, A minus B equals C? I would just love that. So that's not going to happen right now. There may be a time that happens, but it's not now.
Cullen explains why. You see, the definition of recovery is still not clear. Does it merely mean you survived? For that, subtracting the number of cases with the number of deaths, you get the survival rate.
Who is still alive after X period of time of having the virus? And that is one way that we define survival. It's really a survival rate more than a recovery rate.
Cullen says the recovery rate is hard to get to because it ranges from still having to be hospitalized to being fully back to good health. And right now, recovery has not yet been clearly defined. That needs to be done by the CDC because it's a public definition, not a clinical one.
So I expect that within the next 2 to 3 months, we'll have a definition.
She says in the constantly changing course of COVID-19 and the accelerated caseload, it'll be difficult to pin down the recovery rate right now.
It hasn't been like the flu. We've dealt with the flu for a really long time. This is a new disease. People are not aware of the long-term consequences.